Preparedness is key to surviving a disaster. Medical assistance teams have become integral in response to disasters. The Rhode Island Disaster Medical Assistance Team consists of health professionals trained to respond to public health emergencies. This team has offered their services in every major disaster in the United States since 1995. Health personnel can be deployed as needed and provide triage, medical assistance, and general support and care for all those victims affected by the disaster. This public service has been a collaborative message from the University of Rhode Island College of Pharmacy and the University of Rhode Island Film Media Department.
I'm Dr. Keith Monchik, clinical instructor of orthopedics at Brown University, as well as the Rhode Island Hospital. I've also been a member for over a decade on the Rhode Island Disaster Medical Assistance Team as a medical officer. As a member of the Rhode Island Disaster Medical Assistance Team, we fall under the National Disaster Medical System. The National Disaster Medical System has had a long history. Currently, it falls under the Department of Health and Human Services. The National Disaster Medical System is a three-pronged system. The system involves three major arms of that. The first being the disaster medical assistance teams, as well as the disaster mortuary teams. On the second arm is the international deployment arm. The international deployment arm is the International Medical Surgical Team. There are currently three teams that exist in the nation. One is IMSIRT West, one is IMSIRT North, and one is IMSIRT South, based out of Seattle, Boston, and Miami, respectively. As part of the IMSIRT team and the DMAT teams, it's a comprehensive roster. It's essentially a mini hospital. We basically transplant, like here at Rhode Island Hospital, a full functioning level 1 hospital into a remote area whose sole goal is to do as much as it can with as little as it can. As far as the response to Haiti goes, this is the first time that all three components of the NDMS team have been activated at a similar time. The day after the earthquake happened, IMSIRT team got activated within 24 hours. I was deployed on January 23rd as a backfill, along with two other orthopedic surgeons from across the country, to respond and relieve the original IMSIRT team that had been stationed in Port-au-Prince. The DMAT teams had been stationed at a variety of places within Haiti, but the IMSIRT team had been stationed at what was called the Guesquio Field Hospital in Port-au-Prince. The Guesquio Field Hospital quickly became, within the first 2 weeks, the only ventilator capability, critical care, and surgical operating facility and local trauma center for all of Port-au-Prince. Numbers of patients they saw were anywhere between 200 to 300 patients a day, doing anywhere between 10 to 20 operations a day. We had a situation that we had a preponderance of musculoskeletal injuries and we had a preponderance of operating. Because of that, we needed a large stock of antibiotics that probably wouldn't be something that a normal hospital or a hospital catch would carry.
I thought at one time that the biggest event of my lifetime would be the World Trade Center disaster. The morning of September 11th in 2001, I was working at my office at Rhode Island Hospital, and somebody came in my office and told me that there had been a plane crashed into the World Trade Center. And at 7 o'clock at night, we left Rhode Island Hospital with 63 physicians, nurses, paramedics, and our gear, and traveled to New York City, and were there the next day. And we were there for the next 2 weeks providing care at the site of the World Trade Center disaster at Ground Zero. I thought at one time that would be the disaster of my lifetime. My father was a Pearl Harbor survivor, and that was the disaster of his lifetime. 4 years later, I really couldn't have imagined that would respond to Hurricane Katrina, and it would be worse. Haiti was a system where the whole medical infrastructure, while shaky at the beginning, was almost eliminated.
So the biggest obstacle in getting aid to any disaster-struck area is, without a doubt, logistics. In the instance of Haiti, we had a single runway that was controlled by the U.S. military, eventually. And that meant that X number of flights could get in per day with an X number of minutes on the ground. Now you're reliant on a chain, and that chain is your resupply. If that field hospital can exist for 72 hours and it doesn't need supply for 72 hours, you're good. But at that 72-hour mark, you need some form of resupply. And if that chain of logistics doesn't exist, you're pretty much dead in the water.
Haiti was a precipitous event, an earthquake that devastated a country that was in peril to begin with. This was a country where there was no health infrastructure whatsoever, and none available in the short term. The teams that deployed to Haiti had to be very careful to send people, to only send people on the teams who were physically capable of dealing with the heat and the most austere conditions that we've ever operated in.
In the Haitian response, and the response to the Haiti earthquake, Sanjay Gupta was filmed in a video piece where he came out of the airport, had a bag of drugs, and said, "Why, to the effect of why is this not being distributed to the people?" When there's 100,000 people who have no homes, are living in tents, unidentified, in a place where there's poor roads and poor communication to begin with, you can imagine it's very difficult to unload millions of pounds of medications, sort them. Where are you sorting them? There's no warehouse, or if there is a warehouse, there's only one warehouse. If people are on chronic medications, they don't need them just today, they need them all the time.
The situation in Haiti was devastating. I mean, you have to look at their previous medical infrastructure. Was it sufficient before the earthquake struck? Most of the hospitals there were wiped out. People were relocated to wherever. So when a disaster such as Haiti occurred, the country wasn't prepared for it, as they are for other disasters. The medication, the hospitals, I mean, it was all just basically wiped out. They needed to start from scratch, and that's something very difficult to do.
Unfortunately, there was a lot of bad press that came out of the Haiti response as far as the U.S. Response goes. The answer of coming from within the system that I can tell you is that the Health and Human Services hospitals saw over 25,000 people. They did a lot of good for a lot of people, and the response was a very coordinated type effort. Yes, it took a couple days, but it was done safely. It was done efficiently, and that's the way it should be done in a disaster.
It's very difficult to get medications from one location to another. It's not as simple as let's just drive them down the road.
You can't just take a bag of drugs into the street and then decide who needs them. You need to decide who needs them and then bring them to them.
You need to make sure that you have medical professionals there that can dispense them, knows what they're used for, knows what conditions. Make sure the people that need them the most are getting them first. You can't just throw them out there.
An awful lot of humanitarian aid, medical supplies and food and people were dispatched to Haiti. They went to a country that, again, had no infrastructure. The airport was damaged. There were limited opportunities to land airplanes there. The port was destroyed.
Drugs have to be stored under a certain condition. There's temperature ranges where those medications have to be kept. So storage is very important. Security. Someone hears, hey, this tent has pain medication. You have to be really careful all the time. You don't want a riot to break out over, morphine or Vicodin or whatever type of medications they need. You want to make sure that your patients that need it get the medications.